Hi, welcome to Pinnacle Hand Therapy. Today we're going to go inside and we're going to talk about physical agent modalities, also known as PAMs. Is actually called combination. I want to show you this close up. So if I want to do ultrasound and E-stim in combination, I press this button here. And my first order of business is going to be to decide what type of ultrasound. Do I want it to be a deep ultrasound? Do I want it to be continuous? Or do I want to change the duty cycle so that we can reduce it to at least 10%? Again, I set the timing. I decide how much ultrasound output I want, and we're going to go with the usual 1. And at this point, I then have to select my E-stim, which in this case would be high volt. So you can see that I cursor down to high volt. And with the high volt, I'm going to use the presettings. And the patient at this point with the ultrasound will begin to feel the electrical stimulation current. So what I do is I'm going up, waiting for my patient to tell me that they first feel it and then stop when we've met the level of comfort. So that is the combination of ultrasound and E-stim. What's significant about the number 2 is that you always set up your combo ultrasound and E-stim using channel 2. One of the interesting things about ultrasound, whether you're doing it with gel or underwater, is that patients will tell you that they don't feel it. So what I want to do is a quick demonstration to let you know that there are sound waves coming out of this head. So I use the second lead, the red one, and I'm going to actually place it on his extensors, assuming that we are going to be ultrasounding this part. Go ahead and place your hand in the water. Now, the beautiful thing about this is that what I'm going to do is I'm going to use this sound head as one of the electrodes, but as ultrasound simultaneously. I have a couple of options here. I can make my settings over here using this button. I have options for time, and then I will go ahead and begin the ultrasound. Now, ultrasound is very good for deep heating. We use it for scar management. In this particular case, we're actually using it for using the high volt and the ultrasound together, which means that we're looking at trying to control some of the swelling as well as introduce healing, and of course working on the scar. And so what you're watching is ultrasound underwater. Doing ultrasound underwater is like using water as a medium in place of the gel. One of the reasons that we like to use the water is when we want to make sure that we're providing the ultrasound over small digits so that we can actually maintain the sound waves and keep them from getting away. So the water is a wonderful mechanism for that. And then again, as I said, we're doing ultrasound and electrical stimulation. So you actually see that the ultrasound head and the E-stim is being used together in this particular physical agent modality presentation for patient care.